life on dialysis was pretty hard. It was my senior year in high school, so I actually didn't get to graduate with my class, and I had to come back in extra years, and also it made me get distant from a lot of my closer friends.
I've just sort of known for a couple of decades that at some point my kidneys would give out, and that I wanted to maintain the quality of life that I had come accustomed to, and I didn't have time for dialysis 3 times a week. I really wanted to transplant.
By the time I went on dialysis, I was so weak that I knew I had to go for a transplant. I could not live that way. It wasn't working for me.
The lifestyle of a recipient of the kidney is so much better than the lifestyle when they're on dialysis. And almost routinely, the recipient the very next day says, I had no idea how ill I've been for the last 10 years or 20 years. They feel so good.
People say, and this is consistent over the 40-odd years I've been doing this, that they feel different the next day. And even when their kidney function hasn't started to improve, that we can measure, they feel different.
I was lying on the table in the recovery room, and I couldn't even open my eyes yet because I was still groggy from the anesthesia. But I remember thinking to myself, oh my gosh, it's gone. And it was this sort of gunky exhaustion and fatigue that everybody I know with kidney failure feels, and I had felt it for years, probably a decade or more. And so even there on the table, I could sense that I was already better. And sure enough, I came to find out later that I had normal kidney function, the day of surgery.
When we first heard the words transplant, it was overwhelming. But as you get more information, it becomes much more, I don't want to say the word is common, but maybe you're more relaxed about it, you know more about it, so it just doesn't sound as terrible as it did when they first told us those words.
We accept people for transplantation really based on their individual characteristics and risk factors. Our process involves everything. We evaluate their heart first and foremost and their cardiovascular system. We look at their ability to have a transplant placed in their bladder because transplants have to be sewed into their bladder. We screen them for various infectious diseases that they may have had in the past or currently might have. And then there's the various psychosocial factors that go into a successful transplant. Are you motivated as a recipient enough to take the medications that you need to prevent the kidney from rejecting? And do you have somebody that will act as a support system for you?
Every transplant candidate must have a care partner or care partner team. A care partner will accompany you to every appointment and will be a critical source of support. Care partners help you manage information. They provide comfort and encouragement. They help you succeed in caring for your kidney after transplant.
I've come to firmly believe in our choice to have people have care partners after transplant. This is just purely something people can't do alone.
The care partner will be there with the patient from the very first visit through the graduation visit to help them absorb and understand information and instructions in clinic. And then especially at home after transplant, the patient's going to need a lot of help.
Having someone there for you, it really is important. It makes a big difference.
Once the evaluation process is complete, you will either be matched with a living donor or put on a waiting list, where locating a donor can take anywhere from a few weeks to a few years.
Once the patient is listed with us, has been accepted at the end of the evaluation and is deemed a good candidate for transplant, added to the waiting list, and then they can expect to have monthly blood draws, and if they're waiting more than a year, they can expect to come back to see us for a yearly checkup.
if you don't appear to have a living donor, you can still share your story with your loved ones. You never know who may come forward to be your donor.
Living donor transplants is just a better form of treatment. The results are better, kidneys last longer, patients are in the hospital less, they have less complications, you can plan when the transplant is, and the waiting time for a deceased donor transplant, while very short in Oregon compared to the rest of the country, is still pretty long.
The procedure of kidney transplantation consists of connecting three things. The artery of the kidney to the artery of the patient, the vein of the kidney to the vein of the patient, and then the ureter on the kidney, which is the conduit for urine, is connected to the bladder of the patient. Patients don't realize that we do not take the existing kidneys out, which sit behind the ribs in the back. The new kidney is placed in the front, just above the groin, at about the level of the belt line.
When your surgery date arrives, the transplant team at Legacy will ensure that you are provided with the latest in surgical care. After surgery, your hospital recovery stay is often less than a week.
It feels like the easiest thing I've ever done in my 25 years of dealing with kidney disease, which is sort of an embarrassing thing to say about a major surgery, but it was really easy.
So I kind of knew what to expect. I was a little afraid, but as it turned out, my stay was wonderful.
The care that I received after surgery was phenomenal from everybody. Doctors, nurses, anybody that could have possibly been involved was incredible.
So after patients are discharged from the hospital, we keep them close under our care for a total of 3 months or until they're stable with their transplant. So in the first couple of weeks after transplant, that means that they come to see us in the clinic 3 times a week, have labs drawn, see a variety of providers. They see a nurse, a physician, a pharmacist at each visit, even a nutritionist to make sure that things are going okay. And then as they stabilize after a few weeks, then we see them less frequently. It goes down to once every 2 weeks. But we're still communicating about labs over the phone and always strongly encouraging that everyone calls us with anything that comes up while they're away. And then after about 3 months, once we know they're healed and their kidney is stable in their body, then we turn them back over to the care of their kidney doctor.
When you come to clinic in the morning, you're there at the crack of dawn, and you're aching and stuff, and you look around and you see everyone else that's there with you. There's a camaraderie there, and you just feel like, yeah, I can do it.
I've lived in 10 states. I've been treated for kidney disease at well over 24 hospitals and probably 100 clinics in all the places that I've lived over 25 years. And this transplant experience of the last 6 months is the first time in 25 years that I've ever actually had a whole team take care of the whole me.
I felt safe knowing that if something was wrong, they would know what it is. And they were just so nice that when I graduated from here, that it was kind of sad that I wasn't going to see them as much anymore.
On my graduation day at 3 months, they did a little ceremony for me and put a graduation hat on me and played a little pomp and circumstance. And I laughed and I smiled and I walked out of there, and my wife would tell you I was bawling. I was so sad to sort of be leaving this group of people that I had become really connected to. And honestly, I was so afraid of sort of going back to the rest of healthcare.
It is important for you to be actively involved in care after surgery. Ultimately, you are the one that will have the most impact on your new kidney's health.
I have a gigantic pill box, and it has 2 weeks in it, so every 2 weeks I fill it up and I sit and I put every pill in every box, and I have my checklist and I check it twice, and I take my pills religiously twice a day, and it's just become a part of the routine. I have an alarm set on my phone so that I don't forget, and I always have an extra set with me wherever I am.
The nurses and the physicians were all sort of, "Now you've got to make sure that you take your medications on time." And I just sort of looked at them and said, okay, of course. And so for me, taking the medications was no big deal. In fact, the total number of medications I was on before surgery was well over 15, and the number of medications I'm on after surgery is only about 5. Meanwhile, I've got this incredible energy that I haven't had for a decade. I can taste foods again like I never thought that, I didn't even realize I couldn't taste food until I had the transplant. And I've just got these sort of superpowers that enable me to go and do all the things that I used to do in my life 10 or 15 years ago.
I honestly didn't know how sick I was because I didn't have no symptoms. I felt fine, but as soon as I got my transplant, I could tell the difference. I would get my energy back. I started gaining the weight I lost.
Even if you really love your dialysis team, this is not the best place to spend 15 to 20 hours of your week. And even if they're incredibly gentle, sort of putting the needle into your fistula or doing the peritoneal dialysis, the quality of life and the freedom that I have now is just, there's just no comparison between the two.
Thinking about the transplant and everything I went through, it was an experience that, you know, I think I had some reservations about it, but once I got to know the staff and the, you know, people who helped me and were here taking care of me, it was really easy. It truly was.